Hello, I'm Robin Crockham, and this is Nursing 300 to Professor Riley. This video is my view on the delivery of healthcare. Healthcare is a very controversial topic. Healthcare is simply defined as the way care is delivered in the U.S. by the government as well as organizations. Many people feel that everyone deserves healthcare or should have healthcare, but no one wants to fund the cost of care. With the recent onset of the pandemic and COVID-19, we realized how much everyone needs health care. The three issues that affect health care the most would be cost, which is the cost of care, access or access to care, and quality, the quality of the care received. When we think about cost, we think about providers, supplies, services, even technology, all factor into the aspects of cost. The cost is very expensive and it's where many cannot afford. When we look at access to care, many, whether they have government insurance or private or self-pay insurance, is limited. Limited due to availability, limited due to location, and limited due to cost. When we think about quality, according to the text, it says quality needs to be measured in a macro and micro perspective. Quality continues to decrease. We are still working on efforts to improve the quality of care. There's no defined tool, according to the text, to measure or define quality. Next, we talk about the Affordable Care Act. The Affordable Care Act was established in 2013, and this act was just in place to ensure that all individuals receive coverage, health coverage. It was not successful, but it did have some successes. The one most notable success would be that no one can be denied coverage due to any pre-existing condition. That means if you get employed somewhere and you have diabetes or chronic illness, you wouldn't be denied coverage solely for that reason. People can get coverage with those diagnoses. Government programs like Medicare, Medicaid, LaChip are also used for the very vulnerable population. It ensures that the elderly, disabled, and the low-income people have insurance and coverage. A lot of times there's little to no cost for these services. When you look at the other hand, for as private or self-pay, you have to deal with deductibles, monthly premiums, and a lot of out-of-pocket expenses. So that can be troubling at times, especially if you're in need of a service and you have to come up with this $1,500 deductible, for example, before you can have a needed surgery. Providers are the ones who are rendering the care. That can be the physician, specialists, surgeons, dentists, even nurse practitioners. Those are the ones who are providing the care to the patients. Next, we're going to talk about settings. Settings can be inpatient or outpatient. That's what most people are familiar with. But we have acute care settings. We have a lot of new urgent care settings, long-term care settings, and home health, and doctor's offices. With the settings, I like to go with the outpatient and inpatient. They're most common. Outpatient requires no hospitalization, and that's kind of recent. Things like tonsillectomy, lumpectomy, you don't have to stay overnight. It's a lot cheaper. It's less invasive. A lot of times they're using laparoscopic procedures, and it's a quick recovery time. When you think about inpatient hospitalization, these are for the more complex issues such as heart surgery, emergency surgery, and they're very expensive and require a hospital stay. Policy is what we're working on as a government as well as an organization, trying to collaborate and find a policy that meets the needs of every individual. And then no one set of individual be singled out. The rich wouldn't have to pay for everything, and the poor wouldn't have to pay for everything. And the middle class would not be stuck paying for more. It should be something that fits everybody equally. That will take a lot of strategic planning from our government and our organizations to make sure that we're all on the same page. And the overall goal is to create cost-effective care, greater access to services, and improve the quality of care. All in all individuals need to have access to much needed care. It shouldn't be where some people can get care and others can't. It needs to be where everybody can receive the care they need. Thank you.